One is that healthcare is very important for the development of any economy. And actually, Honorable Speaker, in many respects, when we talk about healthcare, education is always just around there, because these are social investments which are basically used to build a good working capacity for any nation. While education adds value, just in manufacturing where it adds value, Honorable Speaker, to the primary produce, what education does is to add value to the working force. But also what healthcare does is actually to service the working force or the labor force. And therefore they are very integral even when you look at it in terms of purity or Puritan economy, Honorable Speaker. But there are issues that continue to handicap, and especially delivery of quality healthcare to our country, as has been said before by my colleagues, one being access, but also number two being quality, Honorable Speaker, and access majorly meaning a cost that is involved in seeking quality healthcare in our country. And Honorable Speaker, the other thing that is critical for us to keep thinking about is that when we appropriate money, we are basically showing the signs on the kind of service we want delivered in the country. And Honorable Speaker, I see it as a paradox that healthcare is actually basically a fully devolved function. But when you look at the appropriation of the money that we give to our counties, vis-a-vis the money that remains in the national government, Honorable Speaker, that leaves a lot to be desired. And I think we need to walk the talk in terms of devolving even the funds and the resources that are needed for our county governments and our governors to be able to provide quality and accessible healthcare in our country. Honorable Speaker, we also have to think about healthcare as dynamic. We have seen in many countries, Honorable Speaker, that R&D budget for healthcare is always adequate, because the challenges that we face in regards to healthcare, Honorable Speaker, is dissipated by new inventions within the industry. And what makes that possible is the budget for research and development, which, Honorable Speaker, can go in many ways. One can be directly provided by the government, but also number two is to give incentives for even private healthcare facilities to be able to invest in R&D by giving them, Honorable Speaker, incentives even around taxes. Because whatever they do, if you get a reprieve which is cheaper and more efficient in terms of provision of health, that then becomes a public good, Honorable Speaker. And therefore it is no longer an asset of the people who invested in it. It becomes a public good for all the citizenry. And Honorable Speaker, that is what we ought maybe to do in terms of policy, that even the private facilities are given an incentive to do better, to come up with better methods, to come up with better reprieve, because ultimately, Honorable Speaker, that becomes a public good. And lastly, Honorable Speaker, it is important that all of us as people who serve the public, that we must continually always show confidence in the facilities that we provide monies for, even in this house. And Honorable Speaker, it's always an oxymoron that most of the public officers have insurances that cover them outside the public facilities. And Honorable Speaker, we should be the people who should be championing for quality service in those public facilities. It is important, Honorable Speaker, that all public facilities, and especially those who are covered using government resources, that we show confidence in public health facilities by seeking services there, Honorable Speaker, when they are needed. Because it is in that line, Honorable Speaker, that we are able to see the challenges that happens in the public facilities, so that as we legislate, as we provide resources, we are doing it from the point of knowledge. And Honorable Speaker, that goes in line with many developed countries, including the United Kingdom, where even the public servants, including the Prime Minister himself or herself, in that case, Honorable Speaker, they promote national health services, famously known as NHS. Because when you provide the best quality service there, Honorable Speaker, and you are the one leading the population, then the best way to show confidence is when you need those services, Honorable Speaker, then you seek them from the point where you lead. And since you lead the public, then public facility ought to be given a dab of confidence by channeling all the health officers, Honorable Speaker, to be able to seek services in the public facilities. Otherwise, Honorable Speaker, I thank you for the opportunity and I submit.
Thank you. The Honorable Karoli Omondi, member for Suba North.
Suba Kusini, Suba South. Thank you very much, Madam Speaker.
Let me just take it again for record.
Okay.
The member for Suba South.
Thank you very much, Madam Speaker. I rise to contribute to this motion, not fully in support, but partially in support. I've looked at the motion carefully and I've picked 3 issues that I think require debate. One is the concern that the public healthcare services lack adequate funds to guarantee quality healthcare services. That is very true, Honorable Speaker. I think we have subjected our health sector to chronic shortage of adequate funding over the years, both in terms of facilities development, recruitment and payment of good salaries for health workers, but also investment in terms of research and other activities relating to health sector. So that is very clear. I agree that with that particular concern. And I've just taken a quick look at what happens in other jurisdictions to emphasize that we are underfunding our health sector. In the United Kingdom, the funding for the health sector as a percentage of the GDP, in other words, the economic output of the UK, is actually 9.6% of their GDP. France is 12%, Germany is 13%, Canada is 13%. Singapore is 12%. And I pick Singapore because it has the second best healthcare service in the world. And also the country where people enjoy the longest life expectancy at 84.5 years. But Madam Speaker, I'm very concerned with the 2 other statements in the motion, appreciating that the use of the comprehensive medical cover by public officers and state officers in public hospitals would guarantee sufficient funding for public hospitals. I submit that this may not be so. As you've just heard, the level of spending on healthcare as a percentage of GDP in the other countries, I don't think the insurance schemes that are given to civil servants or state officers or members of public or members of parliament would be sufficient to cover the health service requirements, financial requirements of our country. I don't agree with that, and I would have been happy to see the statistics, but I don't think it is factual. As a matter of fact, I think it would just be a drop in the ocean. But I have a fundamental disquiet and reservation on the main thrust of the motion, that we introduce a policy on mandatory use of public healthcare facilities by all civil servants, public officers, and state officers in the country. Apart from technically being impossible to enforce, I appreciate where this is coming from. As a matter of public confidence, those in position of authority and leadership should actually go to public hospitals. And that is how it is in other jurisdictions. If you go to Germany, 55% of the healthcare facilities are actually public. And by public, I mean publicly funded and publicly owned. Though there's a mixture of what is public. Some are private, some are charitable, some are faith-based, some are university hospitals and the rest. But in Germany, only 38% of the healthcare facilities are charitable. 55% are public. As a matter of fact, only 7% are private. In the UK, 92% of the population use public healthcare facilities, the NHS. And that is whether you're in Wales, England, Northern Ireland, or Scotland. Only 8% use private hospitals. But you see, they do so not as a matter of legal requirement or as a matter of compulsory administrative action. They do so because their hospitals work. So I think the most important question we should ask ourselves is, why do hospitals work in other jurisdictions, public hospitals, and not in our country? And I think it has more to do with other questions other than this. Second, I mean, most fundamentally, if you try to compel a civil servant to go to a particular facility and they go to court, you will not win that case. Because they are matters of choices, they are matters of rights, they are matters of freedom. It would have been neater to limit the application of the medical insurance for public servants, that you insure for purposes of getting treatment in public health facilities. But if you want to go to another, seek another option.
Order, Honorable Karoli. I have a point of order by the Honorable Sabina Chege. What is out of order, Honorable Sabina Chege?
Thank you very much. I just wanted to inform my colleague, Honorable Karoli, that I had indicated earlier.
Honorable Karoli Omondi, would you like to be informed by the mover of this motion?
Yes. I had indicated earlier that there was a slight change on the motion, that we, at the last how it's reading, that let me see where to start. Through the ministry, that therefore resolved that the government through the Ministry of Health implements the Kenya Universal Health Coverage Policy 2020-2030 and introduce a policy on mandatory use of public health care facility by all civil servants, public officers and state officers who are using medical cover catered by the government of Kenya. That bit was missed out, and I hear you, what you were saying. It was about the medical cover and medical cover that is financed by the government. But public officers or civil servants, they have liberty to choose where they can access their medical care, whether they want to go private or public. But if you are using a medical cover catered for by the taxpayers' money, then the first stop should be in the in the public facility.
Thank you very much,
You may
Honorable
proceed.
Speaker. I thank you for that information, Honorable Sabina Chege. That would be the right approach. However, it would not be right to make it mandatory. It would be an option, so that if I wanted to use my cover in a private facility, then I would be allowed to top up whatever is being charged in the other facility. But I think fundamentally, Honorable Speaker, we have messed our healthcare by devolution. I think I've said it several times here. Healthcare should never have been devolved. Because if you look at the experience of other jurisdictions where health services are working, they are centralized. And if they are not centralized, there are other agencies that provide the health services at the lower levels, but are controlled from a central point at the national level. For universal healthcare to work, which is an insurance scheme, it must be centralized. That is when you have a pool of enough people and enough resources to put together to run a universal healthcare scheme. And I think the good example is the UK, which has the NHS. Even though the NHS, in terms of implementation, is decentralized, it is centralized in that it is fully financed out of the national budget of the United Kingdom. If you go to Germany, they have both federal and local hospitals, but which in terms of implementation are decentralized, but the funding is not decentralized. In Italy, it is centralized. They have something called Servizio Sanitario Nazionale, and health provision and health standards and employment of doctors and health workers are centralized. If you go to Norway, they are centralized. I mean, under the Ministry of Health, though they have regional health service providers. The same in Australia, where they charge a medical levy and health is provided at state level, but funded by the federal government. So I think we need to have a thorough discussion. How do we reorganize our health sector within the framework of devolution without compromising the ability to mobilize adequate resources by pooling, and also providing all the health workers with a common employer, just like we have with teachers, so that the standards of quality of service, quality of payments, quality of the personnel is standardized across the country. If we don't need any further research, we know health sectors cannot be run by the counties. It is obvious. If you go to all the county hospitals, you see it happening. The question is, when will this House or the government be brave enough and try and bring back health under a centralized system. And the national health, the universal health service or coverage will not work within the framework of devolution, because they are never intended to work like that. If you look at all the other jurisdictions, and Madam Speaker, I think it is time that we had this debate without burying our heads in the sand that we will look like we are fighting devolution. We are not. It is important that we give our people universal health cover and a standardized standards of service across the board. Thank you, Madam Speaker.
Thank you, honorable members. Before we go to the next speaker, we have our guests seated in the speakers gallery this afternoon. Students from Linus Wairuru School from South Imenti in Meru County. Let us welcome to the house. Also seated in the public gallery, we have Gesumin Girls Secondary School from Brett constituency in Kericho County, and students from Naibor Amani Primary School, Laikipia North constituency in Laikipia County. You are all welcome to the National Assembly to observe proceedings of the House. I will allow the Honorable Joses Lel Mengit, member for Ingwen, to welcome all students and also make his comments.
Thank you, Honorable Speaker. I would like, just the way you've directed, to welcome all the students who are here today in the chambers from different institutions, and to tell them to feel at home. This is the place where you will be in the future. This is a house of parliament where we make laws, where we legislate, where we represent people and do oversight. This is a learning curve for you, and I also want to thank your institutions for allowing you to come here today so that you can learn one or two and get the first-hand experience here in Parliament. We've been there before, several years back, and we were very determined, we were very focused in our education, and that is why we are here today. So congratulations for coming here. When you go back home, give a good message of Parliament the way you've experienced here today. Thank you, Honorable Speaker. Back to my statement or supporting, Honorable Speaker, I would like to support this motion by Honorable Sabina Chege on universal health coverage to make it mandatory for the public state officers and the civil servants to use public facilities. Honorable Speaker, the biggest challenge that we have currently in our constituencies, a number of fundraisers that we are called to support are on either education or on health issues, related issues, which means this is a critical subject that we are discussing here today, Honorable Speaker. And as much as we would want the government to facilitate for all or cover all the medical expenses that patients incur in this country, Honorable Speaker, resources are scarce. And remember, Kenya is a third world country. We are not a first world country that we can manage to consolidate all the resources and make the healthcare system free. Honorable Speaker, I want to agree with the motion by Honorable Sabina Chege that state officers and public officers should lead by example to get medical treatment from the public institution. That way, Honorable Speaker, we will assist and make these institutions even get funding, especially with the current share medical scheme, where specific health institutions receive a certain amount of money based on the number of users using that facility, whether in primary health care or up to primary health care up to level 4, level 5, level 6 hospitals, Honorable Speaker. Recently, I had testimony from one of the administrators in Kapsabet Hospital where he told me, while we were still using NHIF, the amount of money that they used to receive, because they used to receive the money quarterly, Honorable Speaker, they used to receive close to 800,000 in every 3 months. They could not even budget to buy medicine and also buy non-pharmaceuticals. But they have a very good testimony right now, Honorable Speaker, where SHA pays these hospitals or remits money every month. And the money is good amount, close to 3 to 4 million now. So they can be able to budget for medicines, and also they can be able to budget for non-pharmaceuticals, like the gloves, the needles, and make it available in the hospitals. So, and that is within a month. So you see the kind of medical scheme that we have currently on SHA is better than the previous one that we had. Also, Honorable Speaker, we need to lead by example, because this country, the public institutions are failed. They are not being run adequately, be it hospitals or schools, Honorable Speaker, because these two things are conjoined, whereby private institutions are more praised than the public institutions. For example, in schools, Honorable Speaker, the teachers who teach in private schools are the same teachers who undergo the same training with the teachers who teach in public institutions. But where did we miss the mark, Honorable Speaker? I would like to encourage all of us, because as members of Honorable House, that it is possible to make the public institution uplift their standards and get enough or medical treatment that is equivalent to private institutions. So, Honorable Speaker, also pulling those resources together by members of parliament and leading by example will will enable us uplift these institutions to the standards that we want. Also remembering, Honorable Speaker, the civil servants in this country are close to 950,000. These civil servants take a portion of the revenues that we collect in this country by the exchequer, which is close to 1 trillion shillings. As per last year's data, recurrent expenditure of this country is close to 1 trillion shillings. The employed civil servants and state officers are close to 950,000 in this country. All the money that is being collected by the taxpayers, Honorable Speaker, are consumed by only close to 950, barely a million Kenyans. The rest of the 56 million Kenyans, Honorable Speaker, don't enjoy this kind of service. And that is why we want to encourage the civil servants, for the sake of the rest of the Kenyans, to come together, agree on this policy or this statement, so that we can also be fair to the rest of the Kenyans who are paying these taxes. Thank you, Honorable Speaker. I would like to support.
Thank you very much. Honorable members, you notice that most of us are speaking for 8 to 10 minutes. And if you wish, you could make a decision to do 3 to 4 minutes. Then it means more of you can speak. I would like to go to the Honorable Member for Samburu, the Honorable Police Lengoris.
Thank you, Madam Speaker, for giving this chance to contribute to the motion. And from the onset, I want to support the motion by Honorable Sabina. This is a very important motion, Madam Speaker, because for many years, Madam Speaker, we have been talking about the universal health care in this country. And the objective of the universal health care, Madam Speaker, was to ensure that there is access to the health care services, there's affordability, and there was also quality to the healthcare services to the wananchi. Madam Speaker, and if you talk currently about what the service provision at our public facilities, Madam Speaker, I would not be ashamed to stand here and say that it's worrying, Madam Speaker. The situation is really worrying, and the quality of healthcare service provided to the wananchi is actually very poor, Madam Speaker. Even after the devolution, and considering even the kind of support the county governments have received from the national government. Madam Speaker, the patients who access services currently at the public health facilities especially in the place I come from, are really complaining so much. If you look at the health personnel, in the public health facilities, we have the highly trained and qualified health personnel, but most of them, Madam Speaker, are providing services at the private facilities where they will be paid, and at the same time, they are still paid by the government. If you look at the patients who go and queue at the public facilities, most of them will stay to very late waiting for the services at the outpatients, and mostly when they are provided, they are seen by the consultants, they will only be written a small paper and they are referred to go to the private facilities where they could get other more investigations like X-rays, like blood investigations, and even for pharmacies for the drugs that the patient would require. That means, Madam Speaker, that there is a big gap in our public facilities. And the introduction of SHA by our president and the passing of the laws that support implementation of SHA by this House is really coming to be a great support to our health facilities. And I want to call upon the government, the county governments, the governors who are in charge of the county government to give a lot of attention to the healthcare provision at the county levels. Because the introduction of SHA, Madam Speaker, is going to be a relief even to the county government. Because the implementation of SHA is going to ensure that services from level 1 to 4 is going to be free. And the money that is going to be remitted to the health facilities is going to help in the improvement of our facilities, even in procurement of the products or commodities that the health facilities will require. So I want to encourage and ask the governors and the people in charge of the health facilities at the public institutions to be serious, because the provision is poor, the treatment of patients is not acceptable, even the food, the hygiene is really worrying. And I want to ask that this is going only to be possible if the county governments are going to be serious on what they are doing in terms of provision of healthcare facilities. The ones taking care of our facilities at the county levels are qualified staffs. So the only thing they require to have is the commitment to the service to the wananchi. Because what we are seeing now, Madam Speaker, is really worrying. And that is what is encouraging even people to run away from the public facilities. But since now they are getting a lot of money from the national government, they are going to get a lot of support from SHA. The only thing we require is commitment and supervision, and also ensuring that staffs who are employed by the government should first give priority of their services to the public facilities. And this will ensure that the services will improve and our wananchi will get what they are supposed to get from our facilities. Thank you, Madam Speaker, and I want to donate time for other members who have not spoken. Thank you so much.
Thank you very much. If you can go that way, more of you will speak. The Honorable Jackson Lekumo Ntare, member for Samburu East.
Thank you, Madam Speaker. Madam Speaker, I also want to add my voice in this motion. And Madam Speaker, health is very important to all Kenyans. And we really need to take bold steps, Madam Speaker, so that the Kenyans will get health services. Universal health coverage, Madam Speaker, it is required every individual in Kenya to be able to access the health services. And Madam Speaker, there is this issue of SHA. SHA is working, and Madam Speaker, it is not solving all the problems of Kenyans. Even if, Madam Speaker, it is there, but you can imagine, Madam Speaker, Kenyans are going to the hospitals which they are not getting services. Madam Speaker, the health in the country is wanting, and there are no services in these public hospitals. And Madam Speaker, I even interacted with a patient in my constituency who went to hospital, and they were told to go and even get that injection for somebody to be operated. And I wonder, Madam Speaker, even if we make mandatory to civil servants to go to get services there, but there are no those services, Madam Speaker. And I think the civil servants, people are even contributing for their services, and we cannot force people to go where there are no services. And I think, Madam Speaker, the county government must work so that the services be available in the hospitals. Madam Speaker, even the contribution of SHA, it differs from one person to another, even the people who are really not able to pay. And I heard, Madam Speaker, when this SHA started, I think there was a group that the government said they will pay for those who are not able to pay. This is the time now, Madam Speaker, the government will bring that modality of helping other Kenyans. We have heard that nowadays people are paying the whole year. People who are not able to raise the money required. And I think, Madam Speaker, if there is that group, that category, that the government of Kenya intending to pay for those who are not able to raise, then this is the time now they have to come in and help. And I think what is very important is the services to be available. And this is a good motion, Madam Speaker. But I think let us not go that direction of making it mandatory for our civil servants to go and maybe to pay the insurances in those hospitals. Because unless the services are there, and I think the primary purpose of any insurance is for the person having that insurance, not the hospital. And we cannot force people to go and get services where there are no services. So, Madam Speaker, I just want to say that is very important. The personnel, and Madam Speaker, one issue here. There are private clinical hospitals and all that. But I don't know, Madam Speaker, I don't know whether this conflict of interest work when it comes to medics, because you find that somebody who is employed by the government is again working in another place and maybe owning those clinical hospitals and all that. So I think, Madam Speaker, that is another problem, and I want just to say I support, and that's my contribution, so that I can save time for other members. Thank you, Madam Speaker.
Thank you very much. The Honorable Robert Basil, member for Yatta.
Thank you, Madam Speaker, for giving me the chance to contribute to this motion. Partially, I support the motion, and I have reasons why I support it partially. If you look at Sustainable Development Goals, number 3, we talk of good health and well-being, and Article 43 of the Constitution talks of rights to quality health care. However, if you look at our public hospitals, they don't provide such quality health care simply because they are in deplorable state, Madam Speaker. Therefore, Madam Speaker, we must improve rural hospitals and public hospitals for that matter, Madam Speaker, because the reason we have increased mortality rate, Madam Speaker, is because our public hospitals are completely unable to provide quality health care, Madam Speaker. Madam Speaker, if you ask members of parliament, most of us go to private hospitals. Why do we go to private hospitals? It's because private hospitals have all essential ingredients, the infrastructure required to support quality health care, which is lacking in public hospitals, Madam Speaker. Therefore, in a nutshell, we must allocate adequate resources.
I have a point of order. Order, Honorable Basil, I'll come back to you. What is out of order, Honorable Sabina Chege?
Madam Speaker, I just wanted to ask whether it's in order for the Honorable Member to mislead the House that the private facilities have everything that we need. I'll urge the Honorable Member, after this session, take a drive, go to Kenyatta University Teaching and Referral Facility.
Are you informing him?
I am informing him.
So I would like to ask him whether you'd like to be informed. Do you like to be informed?
Yes, she can inform me. I'm listening.
You can make it quick, Honorable
Very
Sabina.
quick, because that is the notion that is out there, that our public facilities don't have what it takes. I would urge you, and even any other member, even when you're doing your medical checkup annually, visit the Kenyatta University Teaching and Referral. We do not have such a facility in Kenya or East Africa. So we have the best, and we can even make the others the best. We can't say we will not go to public hospitals because they are in deplorable positions. We have the chance now to improve our public facilities. I thank you for agreeing to be informed.
Madam Speaker, I appreciate the information coming from Honorable Sabina Chege, but I want to tell her that Kenyatta National Referral Hospital, in theory, is a public hospital, but in practice, is very expensive, Madam Speaker. I've had bodies in that hospital who have been detained for more than 3 months because the bereaved family are unable to raise the exorbitant fees that are charged there. We have had a chance, or I've had patients from my constituency who have been unable to be cleared from that hospital because of huge medical bills. So the fees charged by Kenyatta National Referral Hospitals are equivalent to what is being charged in private hospitals. That's why I'm saying the public hospital you're talking about, these are the rural dispensaries, these are the hospitals like Kenyatta National Hospitals, where a majority of the poor are going to, and which are affordable. But unfortunately, they lack the basic infrastructure to support quality health care, Madam Speaker. Therefore, what I was saying, one, it was a mistake to devolve health, Madam Speaker. We should consider taking health back to national hospitals. Madam Speaker, it's also important to understand that the remuneration given to staff in public hospitals is waning. And that is why the staff who are supposed to serve our people in public hospitals are demoralized, Madam Speaker. We have seen them demonstrating, coming to Parliament, seeking for better pay, Madam Speaker. So it's important to underscore that. Otherwise, the motion becomes more of a theory or more of an hypothesis as opposed to being a practical motion that can apply in our country, Madam Speaker. So allow me to submit so that I can now allow other members to contribute.
Thank you very much, Member for Yatta. The Honorable Kasim Tandaza, Member for Matuga.
Asante sana Mheshimiwa Speaker kwa kupata fursa hii. Kwanza nianze kukubali kwamba hii ndio itakuwa dawa ya kusuluhisha matatizo ya hospitali ya umma. Kwa sababu kuna msemo ambao unasema kiatu usichokivaa huwezi kujua kinakufinya wapi. Kitanda usichokilalia huwezi kujua kama kina kunguni ama hakina. Sisi tulioko hapa kama wabunge tunazungumzia kwamba tungetaka wananchi wale wa kawaida wapate huduma bora katika hospitali. Lakini kama sisi wenyewe hatuendi kule, tukaona vile hali ilivyo, basi moja kwa moja hata yale tunayoyazungumza kwamba tungetaka tuwe na fedha tuzipeleke haitakuwa. Ikiwa magavana wetu ikifika wakati wa kuumwa wanaenda Ulaya, na wao ndio ambao wana fedha za hospitali, wao ndio ambao wanatakana waweze kuweka vifaa katika hospitali, basi moja kwa moja fursa hii ya kuwa hospitali zetu zitakuwa bora ndio sisi tuende haitawezekana. Ni sisi tuende ndio tuweze kuziboresha, na nafikiri hiyo ndio maana ya huu mswada, kwamba ili hospitali za umma ziweze kuboreshwa, basi wafanyaji kazi wote wa serikali pamoja na wabunge pamoja na maofisa wengine, hata rais aweze kuhudumiwa katika hospitali hizi, na ndio hapo zitaweza kuboreshwa. Ningetaka kumalizia na swala la ugatuzi kwa upande wa afya. Hili ni jambo ambalo litokee na limesaidia kiasi kikubwa. Nitakuwa mfupi nikisema kwamba katika kaunti ya Kwale ile inayotoka mimi, kwa miaka 60 ya uhuru wa nchi hii hatukuwa na mahali hata pa upasuaji, lakini kwa sababu ya ugatuzi sasa tuna hospitali takriban 4 ambazo zinatoa huduma ya ugatuzi. Hatukuwa na mahali kwa chumba kile ambacho kinaitwa ICU cha wagonjwa mahututi. Kwa hivi sasa tuko navyo. Kwa hivyo yule anayezungumza kwamba inahitajikana iregeshwe katika serikali kuu, nafikiri yeye labda anaishi kwa ulimwengu mwingine ama hajatembea katika zile counties ambazo zilikuwa zimeachwa pale mbeleni. Lakini mfumo huu unasaidia, na sitakuwa nimefanyia uhaki ikiwa sitaweza kuchukua fursa hii kupeana kongole kwa rais wetu kwa kuleta huu mfumo upya wa SHA ambao unaweza kutoa pesa nyingi. Isipokuwa matumizi yake ndio yanakuwa ni mtihani. Na suluhisho yake ni sisi kuweza kuenda katika hivi vituo na kuangalia na kukabiliana na yale mapungufu yaliyoko pale. Asante Mheshimiwa Speaker, naunga mkono hoja hii.
Thank you. The Honorable Cynthia Muge, member for Nandi County.
Thank you, Honorable Speaker, for the opportunity to contribute to this motion that has been brought to the floor of this House by the Honorable Sabina Chege. Honorable Speaker, I appreciate her thoughtfulness in this, because, Honorable Speaker, healthcare is a matter that is dear to each and every one of us. And, Honorable Speaker, I must say that I appreciate the boldness in Honorable Sabina, because she has been able to aptly point the fingers at the right place. She has been able to state and mention the public servants, whom I am included, Honorable Speaker. And, Honorable Speaker, if you look at the responsibilities that we take as public servants in whatever capacity that we serve in, Honorable Speaker, this is the team that is entrusted with the allocation and management of funds that go into the public sector. And, Honorable Speaker, I think it is just unfair that we have these people who have the responsibility of allocating and managing the funds to be able to feel the impact of their decisions, Honorable Speaker. And I don't think there is any other better way, Honorable Speaker, of having the public servants, the decision makers, be able to feel the results or oversee the results of the decisions that they have made. Honorable Speaker, I also see this as a proper incentive of improvement. We have spoken as members of this House, Honorable Speaker, to the matters and the issues that are affecting healthcare, including our displeasure about devolution of healthcare. Honorable Speaker, they normally say whatever has gone should be allowed to be water under the bridge, because probably we could reverse the decision, but as it is, we cannot reverse the decision, Honorable Speaker. So what we should do as a leadership is to find proper solutions to make sure that healthcare, while at the counties, or that while it is being managed at the counties, Honorable Speaker, not only works, but becomes affordable and to the people, Honorable Speaker. Lastly, Honorable Speaker, the reason why we have issues with public facilities is because of something called public confidence. The public, Honorable Speaker, has lost confidence in public facilities. One of the contributing factors of the public losing confidence in those public facilities, Honorable Speaker, is because most of the time, us, the decision makers, do not partake of those public facilities or do not use them, Honorable Speaker. And I want to support this motion. Of course, Honorable Speaker, there is a lot that needs to be done so that we can be able to get proper and quality healthcare services in the public facilities. And, Honorable Speaker, I join in the members and in the comments of the members that have been made, Honorable Speaker, that this country has to make sure that the health facilities that are public work. That way, Honorable Speaker, we can then be able to make healthcare affordable. And I want to appreciate the coming in of SHA, so that in this SHA, Honorable Speaker, we can finally have the facility improvement fund working, and we can finally have the facilities down there that are called rural, Honorable Speaker, be able to have their money, be able to manage their issues, and be able to serve the people better. So, Honorable Speaker, I support this particular motion, and it must be noted, Honorable Speaker, that this is not, does not have an objective of exposing anyone to suffering, but it is a proper wake-up call to the leadership and to the servants in this country, Honorable Speaker, that healthcare must be accessible and must be affordable and must be up to proper standard so that the people of Kenya can be healthy. And a healthy nation, Honorable Speaker, will be a healthy nation going to the future. I support Honorable Speaker. Thank you for the opportunity.
Thank you. The Honorable Janet Sitiene, member for Turbo.
Thank you, Honorable Speaker, for giving me this opportunity to add my voice to this motion brought by Honorable Sabina Chege, and I would want to thank her for bringing this very important motion. Honorable Speaker, a healthy nation is a strong and stable nation, and therefore every person having a right to the highest attainable standard of health is a very important aspect. And therefore, I want to support this motion and request that we increase the funding for health, for our health care in this country so that we can be able to get quality health care services to our people and ensure availability of drugs in the hospitals, all hospitals from level 1 across board, ensure that their drugs are available. And Honorable Speaker, I would also want to support that we build the confidence in our institutions by ensuring that the public servants actually go to these facilities, which by doing so, we will be oversighting these institutions. Once we are there, we will even stop the doctors hopping from one private facility to the other to provide services, whereas they should be providing the services in the hospital.
Order,
that they
Honorable
have been.
Janet. I know that there are members who would have really wanted to participate in this motion. The Honorable Charles Ngusi Anguna, the Honorable Kwenya, the Honorable Wilberforce Oundo, the Honorable Ibrahim Sanei, the Honorable Catherine Omanyo, among a few others. But it's unfortunate that now time is up. Honorable members, you have a balance of 8 minutes, Honorable Sitiene, so you are free to come and participate another time. Honorable members, and the time now being 2 minutes past 1 p.m., this House stands adjourned until today, Wednesday, 23rd July 2025 at 2:30 p.m.